Thank you for taking this time to be with us.
Absolutely.
You've dealt with a lot of different patients from a lot of different backgrounds. Tell me a little bit about what you've learned with your research, that how religion, how one's faith helps them as they deal with illness.
Well, you know, medical illness is really challenging for a lot of people. The disability, the changes that affect their control over their life, their family changes, it can be really, really challenging. And religion provides a powerful way that people cope with a lot of the challenges that medical illness causes, whether that be disability or chronic pain or whatever, you know, the threats to your life and your survival. All of those things create anxiety and affect your sense of control and may kind of overwhelm a lot of people, make them depressed. And so we see a lot of depression among the particularly people with chronic medical illness, lots of depression. And so religion is really a powerful way that people cope with this adversity. It gives it meaning, and allows them, gives them a sense of hope in otherwise pretty desperate situations.
So it helps with hope. So it sounds like what one believes is very important.
What one believes is very important. It's the belief a lot of times that is, well, that's driving the behavior. Now, of course, belief has to be connected with behavior as well, you know, but those two together, the belief driving the behavior and the thinking, the thought processes are very important.
Now, talk a little bit about the behavior and how that comes into play.
Okay, so doing the things that your faith tradition encourage you to do, such as praying, such as reading religious scriptures, being part of a faith community, being active in that faith community and participating in it. I think all of those things are very important in terms of behaviors, also in terms of health behaviors, such as drinking and smoking, and exercise and watching your weight and your diet. All of those things also are behaviors that influence your health, your mental outlook, as well as conform to many people's religious beliefs. But they're challenging to do. You know, they're challenging.
So the beliefs impact certain behaviors, what we might call positive behaviors, going and engaging in certain religious activities.
Yes.
But also it sounds like some preventive behaviors.
Yes.
Keeping one away from smoking and drinking and so forth.
Exactly.
Okay.
And then also in terms of behaviors of treating your colleagues and your family members and your commitments in those areas and living those out, I think are very important. And they have, it's interesting how they have effects that you don't ordinarily would anticipate, but particularly for people with chronic health problems who, you know, may depend very heavily on family. And that may be hard for them. It may be hard for their family members too. And those relationships really have to be in tip-top shape to handle those stresses.
So when you think about, for example, Christianity, that talks a lot about family and so forth, it sounds like you're saying when those family relationships are what they should be from a Christian standpoint, then the health goes better for the individual.
Yes. Yes, absolutely. Mental health, and of course mental health is reflected in physical health as well.
I see. So if someone were to say, well, I want to be healthier, so I'm going to be religious, would that work?
Would it work if you say, well, you know, I'm having health problems and I'm not religious now, I'm not actively involved, and maybe I'll become more religious and then my health problems will go away? Well, you know, there's some truth in that, and there's also some falsity in that as well. The truth part of that is, yes, engaging more in a faith community and working on your spiritual life and your relationship with God, that can help you in many ways, both mentally, physically, socially, in all areas of your life. So yes, I would encourage you to do that. You know, now on the other hand, if if you expect, your health problems just to go away when you do that, that's just not going to happen. It can play a huge role in disease prevention as well as in response to treatment. Mm-hmm. But when health becomes your God, and you're using religion as a means to this other God, that's probably not going to work. Mm. So you have to be careful. God has to remain God in your life. Mm-hmm. And if God is God, and you worship God, and you do it faithful, and you do it for the right reasons, then better health will automatically follow. Mm. Now, a lot of times, we have to go through difficult things. And we are faithful, and we do good things, and we're praying, we're doing good things in the church, and yet we're still sick, and we're still got the illness and chronic pain, and some of those issues, we're just not going to know the answer to that. Mm. Sometimes, God uses those things in people's lives in a powerful way to affect others that you could never predict on this side of eternity. Mm-hmm. And so you have to just be aware of that. I've got lots of patients who are as faithful as you could imagine, mm-hmm. who are really having a hard time. Some even close to suicide, and yet they are just holding on just by the grips of their fingernails, and their faith is critical to that.
So it sounds like there's intrinsic and extrinsic, and when the religion or the beliefs that one has is driving what they do, that gets, especially the folks you just referred to, kind of gets them through that.
Yes.
But if they're just being religious for the sake of being healthy...
Right. That's probably not going to work. Now, people do things for the silliest of motivations. A lot of time God rewards it, so mm-hmm. we don't understand this completely. But if, for example, somebody reads an article in the paper that says, okay, people who go to church live longer, and they say, well, by golly, I want to live long. I'm going to church more often. So they go to church for the wrong reason. Right. And yet they listen to the sermon and it kind of affects them, and they start, maybe I ought to pray more. They start reading the Bible or praying more. And pretty soon, by golly, their health is better. Uh-huh. So, they may have gone in there with the wrong reason, but see, I guess God could straighten you out pretty quick.
So it could work out in the long run.
It could very well work out in the long run.
Very good.